Here, the number of people who've died from COVID-19 in care homes is being included now in the daily update alongside fatalities in hospitals. But of course, many other people are dying in their own homes because of a lack of testing, and the actual numbers are unknown. Well, joining me now from Somerset is Dr. Jane Townson, who's head of the UK Home Care Association. Thank you very much indeed for joining us, Dr. Townson. Could you tell us, first of all, about why and how you think people are dying at home because of COVID?
Well, the Office of National Statistics does publish data on people who've died in their own homes, which are taken from death certificates, and that's been reported this week at 4,570 deaths, of which 883 are said to be attributed to COVID-19. But there is no routine testing of people in their own homes, and it is quite possible that the non-COVID-19 deaths ascribed could be due to COVID-19, but nobody actually knows. There is evidence that some people have, experienced a dangerous reduction in their oxygen saturation levels due to COVID-19 before they become breathless. So they may not actually seek medical help quickly enough. And we do know also that quite a lot of people are staying away from hospital because of fear of infection and a concern that the hospitals are overwhelmed. We're also concerned because people are cancelling their care visits, and that can either mean that they're left on their own or that their family carers are under increased pressure and stress due to having to look after them.
Is it also a case, not just of people not wanting to go to hospital, but hospitals, because of the pressures of COVID, not wanting those showing other symptoms to go to hospital, or indeed discharging them early?
Well, in actual fact, many of the hospitals are not operating at full capacity.
Well, that's now, but we're talking about a period of a couple of months now, aren't we?
Yeah, I mean, definitely the messages in the beginning were, to be careful not to overwhelm the hospitals. And certainly the official guidance from the National Institute of Clinical and Care Excellence was that, people had to meet certain criteria to be admitted. So certainly colleagues in the care home sector have had problems getting people medical treatment when they needed it. In home care, actually, we have been able to get people to hospital when they need it. And also there'll be people who are maybe developing conditions, lumps and bumps, for example, that need to be investigated, and they're not going for those investigations. So we could see the death toll rise. And we're also concerned too, because the home care sector is under extreme financial pressure due to COVID-19. It entered the pandemic in a weakened position, and costs have risen by at least 25 to 30%. And because people are cancelling care visits, the revenue has gone down. So we're seriously concerned that we could see multiple provider failure within 8 to 12 weeks. And if people are left without care because their home care providers go bust.
But on the other hand, if carers coming into homes don't have the protective equipment which they need, it's not surprising that people are cancelling those visits, is it?
Well, that's another factor. And in fact, some of the home care providers are having to notify the regulators now because they're struggling still to access personal protective equipment. And the issue is that there's a global supply shortage, and that which is coming into the UK appears to be being prioritised for the NHS. So when providers try to order supplies directly themselves, they're finding that the stock is being taken at the docks and moved into the NHS supply chain. Now, that wouldn't be an issue if home care providers were able to access from the NHS supply chain as well. But at the moment, we're not having any success doing that. So many providers are seriously concerned about running out of masks and running out of money.
Dr. Townson, thank you very much indeed for joining us.